Well, I grew up here. I was one of four sons, and my father was a physician. And I went through Friend School, and which we all did. Grew up locally. We lived at Delaware Avenue and Jefferson Street, which is right on Delaware Avenue, right up from what is now the Wilmington Hospital. So I was actually born in the old Wilmington Hospital. My father was very busy. During the World War II, he was one of the few physicians left in town. So he covered 3 practices. He worked 18 hours a day, 7 days a week. He had nurses that made rounds for him in alternative hospitals. In other words, the nurse would make rounds in the Memorial, and he would make rounds in what's now the Delaware. And if something was bad, she would call him in, he would go see the patients. And they had huge practices. He had 2 residency programs, one which he ran both of them, one at the Memorial and one at the Delaware, which is now the Wilmington. But he survived. He survived, as we all did, the war, and things got a little bit more sensible. It was a huge amount of self-study. In other words, you had the books, and you had, as you got into the clinical years, you did the same sort of things. You'd make rounds and see patients and work them up and do histories and physicals and things like that, but you also did all the white counts and and the urines, and you did all that. So laboratory work the medical students did, which was absolutely worthless, but it did keep the bill down, I guess. You lived it. I lived right next door to Hopkins, and that's all we did for 4 years. We didn't do anything else. Very little else outside, because you were consumed. It was enormous fun. But most of us spent most of our time studying. Well, I suppose I naturally went to medicine rather than surgery. Although I went to Harvard one summer and took the Harvard third-year course surgery, because they spent a lot of time in the operating room, and at Hopkins you never got near the operating room. So it was a good mesh, and I did very well. They thought I was terrific. But I found that you had to stand around an awful long time, and of course I was only holding retractors and whatnot, so I didn't think it was such great fun. But it was a wonderful experience. Anyway, I sort of was thinking I was going to do medicine, I guess, rather than surgery. Most of it you think of as on the surgical side. But if you really look at it, it's also on the radiological side. In other words, the CAT scanners and MRIs and all that is in a way brand new. And that's really started to change the way you practice medicine. Because if you can get a CAT scan, and now with total body CAT scans, it becomes much more oriented towards getting the tests. Let me see the data type of thing. It has hugely increased the price of medicine, because and then with all the litigation, which didn't used to exist. The question is, well, why didn't you get a CAT scan? Well, I said, because I listen to the lungs with my stethoscope and the person has pneumonia. And I can tell you from the history what the bug is. You really can. Now, if it's sort of muddled and you don't know, then you don't know. We were much more interested in the olden days of treating, diagnosis and then treating, rather than this huge workup, which just you don't even have to think. You sort of plug them in, shotgun them. You get all these tests, then the results come back, and any idiot can figure out what the answer is. The Academy of Medicine was the place to go. It was far more, it's where all the medical meetings were, it's where all the educational programs were gone, all the symposiums, it was all done at the Academy of Medicine. Merger was done through a project by the Academy of Medicine. It was the big library, so you went there for information. If you were in your office and you wanted an article, you called the Academy of Medicine or a book, and they would deliver it to your office. It was delivered by the pharmacies, who were happy to pick it up and deliver it to the doctor's office. And so the Academy of Medicine played a huge role. We did several things. We had to renovate the academy. We got about $500,000 from Longwood, and really just for capital investment. We needed a new furnace. We needed, this, that, and the other thing, because it needed to be. Nothing had been done, so that was all part of while I was president, and then we made a big to-do about the 50th. I think it's going to be really in what we sponsor. I think we're going to change the membership. I think we'll probably start with nurse practitioners as members, and maybe nurses. I can envision down the line that all different types of groups would use it as would join as a central organization. If the Academy serves as an organizer of meetings, that takes a lot of stuff, to make that happen. And if you get good at it, then the Diabetes Society or the Lung Society or whatnot, they can get the Academy to co-sponsor things. It's absolutely fabulous. Being a doctor is the best thing that was ever invented. And if you don't believe that, then don't go. In other words, I think, some people go take a law degree because it's something to do, and then they don't practice law. You don't do that in medicine. Now then, medicine's so varied that, you can be a plastic surgeon, or you can be a radiologist, or you can be a pathologist, or you can be an internist, and there are all these little things. Medicine should be a fairly all-consuming